Hi, everyone. Thanks for having me here today. My name's Amanda. I'm the Associate Director for the ALS Focus program. I'm super excited to be here. I am in from Tucson, Arizona. And I'm here to tell you about the program if you haven't already heard about it, and encourage you to participate in our new survey on mobility at home. And I know it's close to lunch, so I'm going to keep this super brief. I don't want to take up too much time before I know everyone wants to, get some lunch. So this, if you haven't heard about Focus yet, it's a research study that's through the ALS Association. So like the CDC program, it is an online survey program. But instead of asking you about your past experiences, we're asking about what's happening now. So our surveys happen throughout the year and focus on different research topics based on your experiences, such as your experiences with telehealth, caregiver needs, mobility equipment, insurance, all sorts of things. And our goal is to learn as much as we can from you about your individual needs and preferences throughout the disease journey so that the whole ALS community can really benefit from the amplification of collective experiences. So through the focus surveys, the association can create a database of important information provided directly by people living with ALS and caregivers. So people with ALS and current caregivers, past caregivers are all eligible to participate in focus surveys, and you can have someone respond on your behalf if you'd like. Participants need to be over 18 and live in the United States. Right now, all of our surveys are in English and conducted online, so they can be done in the comfort of your home. ALS Focus is driven by people with ALS and caregivers who participate in our Patient and Caregiver Advisory Committee. We call it the PCAC. The PCAC provides strategic input into the Focus program, such as helping select our survey topics, designing and reviewing questions, and recruiting participants. This helps the program stay grounded in issues that are most pressing to the ALS community. We also have partners from academic universities, federal government, and industry who contribute their expertise to the program. We collect experience and preference data into the database, which can be used to inform programs and policies at the association and beyond. For example, last year we ran a survey on insurance coverage for ALS care. Maybe some of you saw it or took that survey. We asked people about their experiences with prior authorizations, claims, denials, and appeals with their insurance companies. This information is now being used to develop a resource guide to advocate for expanded insurance coverage of ALS care. So I know you just heard about this. The data we collect is kept very secure and confidential. We have an outside committee called an institutional review board who oversees our program and makes sure that our standards for protecting your information are rigorous. And to keep the data anonymous, each participant receives a unique neurostamp, which is just a random code of letters and numbers that is tied to you, and it ensures that our data can be what's called de-identified, which just basically means that your survey responses are not connected to your personal information like your name or your email. So using those neurostamps, the data from the focus surveys can be compared with data from other research surveys while you still remain anonymous. Our de-identified data files are available for the public and ALS researchers to use for free, and we feel that making the data publicly available is super important. Fostering open science is crucial for diseases like ALS, where there's a small group of people and we all need to be communicating with each other and connecting with each other. Researchers can analyze focus data by different factors such as region in the US, demographic information, and ALS disease progression. We want this data to expand the possibilities for discovery in ALS research and to serve ALS advocacy and care. And if you're interested in our results or our data files, they're on our website. So participating in ALS Focus brings the needs and perspectives of people impacted by ALS to the center of the conversation. So we really need you to participate to ensure that we're collecting data that's representative of the entire ALS community. Only you can speak about your experiences, only you can share that, and we want to learn from you and want to continue to improve care for the community, and we can only do that if we're listening. Since Focus started in 2020, we have fielded over 10 different surveys, and about 3,000 people have participated in at least one of those surveys. The more people we get registered for Focus, the more responsive and accurate our research can be. By promoting our Focus data and results, we hope to influence and expand things like patient-focused drug development, clinical trials, equipment programs, and more things like that. So what have we learned from our past surveys? There are many important things we've learned that wouldn't fit all in this presentation, but just a few key findings. 1 out of 4 people with ALS and caregivers have experienced debt or had to borrow money due to ALS treatment or caregiving. And out of 15 different ALS symptoms and functions that we asked about in a survey, the inability to do activities and limitations with mobility or walking is what mattered most to people with ALS. This may seem intuitive to you, like, why do I need to tell someone that? That seems obvious, but it's important to have the data and the numbers behind this so we can rally Congress, so we can get funding for more types of services. So the research and the numbers that we have behind this are super important. Prior to the recent Medicare decision to cover electronic seat elevation, nearly half of people with ALS and caregivers said that their insurance had refused to cover that component on their power wheelchair. And we all know how important this is. 20% thought they or the person they cared for also should have started using their power wheelchair sooner than when they finally received it. 1 in 3 people who had submitted a prior authorization or claim to their insurance for ALS care had been denied before, and prescription medications or medication delivery supplies were the most commonly denied things by insurance, though we heard about many other types of services and treatments that had been denied. This is maybe something that you've experienced and is something we want to continue to learn more about and advocate for getting more coverage of all the ALS, the expansive, array of ALS treatment and care that's available. So now I'll tell you a little bit about what have we done with this data. And this is just a snapshot. We're continually reaching out to make it as impactful as possible. This past year, that focus data on power seat elevation that I just mentioned was used in public comments to the Centers for Medicare and Medicaid Services when the agency was assessing the evidence on the medical necessity of power seat elevation. And Medicare ultimately decided to cover the cost of power seat elevation. So this is the kind of influence the data can have. As I mentioned earlier, in 2022, our ALS Focus Survey was designed to inform an evidence-based resource guide for educating insurance providers on the importance of covering the costs of ALS care early and often. And all of our focus survey results and our public data files were provided to the National Academies of Sciences, Engineering, and Medicine Committee for their study on accelerating treatments and improving quality of life in ALS. That was submitted this year. Hopefully they can collect all of focus research as well as other research, and be able to write some important papers and publications on ALS. So these are just a few ways that the data is being used, but there are many more, and our team continues to engage with researchers at conferences and through partnerships to leverage our focus data and make as big of an impact as we can. So I hope after hearing this, you're asking yourself, how do I sign up? How do I participate in ALS Focus? It's very easy to register. You just go to www.alsfocus.org, and you click the big red button that says, click here to take ALS Focus surveys. I'm also here today next to the Care Services booth, and I have my laptop. I can sign you up with your email today as well if you think you might forget later. So when you click that red button, it's going to take you to our survey platform, which is called Qualtrics. And you'll follow the instructions, you'll answer some questions, and you'll be signed up. The surveys will go directly to your email. Again, any person with ALS or past or current caregiver over 18 living in the US is eligible. And there's a step-by-step guide on how to register on our website as well. So because mobility is such a huge part of living with ALS, we have a lot more we want to learn from the community on this topic. We're really excited to announce that our Mobility at Home survey launched just last week. We've already gotten so many responses, but we need more. As I mentioned, there's power in numbers. This survey focuses specifically on equipment used for getting into, out of, and around your home. We spent a long time consulting with our PCAC and with Care Services staff members to develop the questions. And we really feel the data from the survey will be an important tool for understanding your needs around in-home mobility. And we'll use the results to continue to advocate for improved and expanded overall care. So again, you can sign up for the survey at alsfocus.org, or you can come talk to me. It takes about 20 minutes, which is a little bit longer than what we aim to have our surveys take. We don't want to take too much of your time, but because this is such an important topic, we ask about a lot of different things. This one, is a little bit longer depending on how much equipment you use. Also, if you've participated in ALS Focus before, hopefully you got an email invitation for the survey directly to your email. But you can also go to the website if you're not sure if you've signed up in the past. And just in case you're wondering, what am I going to be asked about in this survey? The Mobility at Home survey asks about 8 types of equipment that people with ALS sometimes use in their homes, such as patient lifts, beds, home elevators. We also ask about home modifications and renovations. And so your responses help us measure access to, the costs of, and the quality of this equipment. The questions are things like, are you able to access what you need? How did you cover the costs? Did you receive the equipment on time? Did you need to modify or renovate your home, or did you have to move from your home? Once you take the survey, please feel free to share it with others in your networks. It's open until October 23rd. And we're really pushing for this to be our biggest survey yet. And like I said, I was going to keep it short. So thanks for taking the time to hear about what we're doing with the Focus program. Again, I really encourage you all to register for Focus and take the new Mobility at Home survey. It's crucial for making sure that your perspectives, your needs, opinions are included in research, policies, and in care services. And we need to hear from you. Finally, I'd want to take a moment to thank the many people who've dedicated time and resources to Focus.
including our amazing advisory and steering committees. It's the best part of my job to get to work with them. I want to thank our academic partners, industry sponsors, and most importantly, our ALS Focus participants. And if you heard this presentation and you're thinking, not only do I want to sign up for Focus, but I want to be part of writing these questions, I want to help direct the survey topics, you can reach out to me at the email here, alsfocus@als.org, or come say hi to me. And we can talk about you maybe joining our patient and caregiver advisory committee. So yeah, thank you all, and I hope you have a great lunch and great rest of the day. And it's really lovely to be here and meet you all.